Thank you very much. Hello, Kadeja, and thank you very much for coming and talking to us today.
No problem.
And Kadeja, you're from the Hamlets Talking Therapies, and this conversation really is just to make our students aware of what's available to them beyond the advice and counselling service at Queen Mary. Queen Mary likes students to access the advice and counselling service first, and so they're aware of any students who are struggling, but there are other services out there, and the talking therapies is one of those. Yeah. So okay, so first question really was just to ask, who might come and see you, who might come and access the talking therapies.
So I guess first of all, you have to be aged 18 or over to access the service, and you would have to have either a GP or a home address in Tower Hamlets to access our services. If you don't have these, there's probably other local services for the students. And to access our support, we would offer support to anyone who has what we describe mild to moderate mental health or well-being difficulties. So this might be maybe some issues with stress. Perhaps a student has suffered with low mood for the last few weeks or a few months, or is struggling. Maybe, that transition to university life might be a bit of a difficulty. Things like anxiety as well. So whether that's to do with panic, whether that's to do with worrying a lot about things. So more on that mild to moderate end, where it's maybe been a difficulty for a few months, a few weeks, and it's just something that you might want some extra support on.
Really helpful, thank you. And what might a student expect? Can you briefly describe the sort of process of what happens when they do get in touch, and what they might be offered, what options there are?
Yeah, sure. So when anyone refers to us, within 2 weeks, they'd be offered an assessment over the phone. Can be face to face if, of course, that's preferred. So that assessment usually is around 30 to 40 minutes and just gives the person an opportunity to talk about what they're struggling with, any symptoms, any history, how long has it been going on for? And the most important part really is thinking about what are the goals of therapy? What is it that you as a student would want from our service in terms of that treatment plan? So after that assessment, we would then get back in touch to give you the treatment options. And of course, from there, you can make a decision with the therapist to decide what is the best route for you. So a few options could be offered. And as I say, it's based on preference, but also the symptoms that you've got. So we'll kind of give that clinical judgment, what we feel is best as well. So the main thing, of course, is usually one-to-one support that we offer. Again, that can be done via video, over the phone, or in person. So that one-to-one support would be guided self-help. It could be cognitive behavioural therapy, which looks at symptoms and how kind they interact with each other, or you could be offered counselling if that is deemed to be more suitable. We also have a really, really wide range of groups. So a lot of the time people do prefer groups just because of that peer support. They might feel that they're less alone with their difficulties as they're hearing from other people who might be going through it. Not to say that our groups are all about sharing, because of course it is quite focused on learning skills and techniques to support you rather than just focusing on sharing. But there can be that element where you can feel a bit less alone. And of course, our groups are on a rolling basis. So it might be that that's quicker to access. And you might think, actually, I would prefer to have that. We also have wellbeing webinars, which are one-off 1-hour sessions. So even if a student feels that maybe they just need a bit of help with sleep, maybe they don't need one-to-one help or a 4-week group, they might want that one-off 1-hour webinar where they're learning different skills, different techniques to help them with their sleep. So those webinars have various different topics, again, spreading over anxiety, stress, low mood, OCD. There's lots and lots of different options, and someone can access that as their main treatment, or they might want a webinar while they're waiting for treatment as well. So once you're given your treatment option, there is usually a wait-in time. So to help you with that, we offer these sessions just to give you something to help you in that interim. And the last option we offer is online support. So if there is anyone who feels, well, I can't really commit to regular sessions, can't commit to kind of a group session or anything like that, don't really want to do that, then the online option might be quite suitable. So the online program that we have is called Silver Cloud, and there's loads of different module options, again, covering the same kind of topics around wellbeing. And with that online, you can access it as and when you want. You can look at the different things that you can learn, the different techniques, fill out various things on this program. So it's quite interactive. and a clinician would leave you a message once every couple of weeks just to say that it's really good you've looked at this. Why don't you try looking at this or building on your skills to do with XYZ? So really, really popular option, actually, especially with students, we find, due to, busy schedules, having to attend lectures and seminars. And this is something they can do as and when. So really, really positive option. So yeah, lots of different options available. So hopefully something for anyone who comes to us.
Right. Sounds great. And am I correct in understanding that that's freely available? There's no cost to that service.
Yeah, that's right. So we're an NHS service, so everything that we offer is completely free of charge.
Right. And how then would a student refer themselves?
So a couple of options here as well. So you can either refer via phone. So we've got our contact number available on our website. You could always speak to your GP as well, and your GP can refer on your behalf. It could even be one of the professionals at the university who could refer on your behalf as well. But the main option that we always find people use is the self-referral online option via our website. So if you even just Google Tower Hamlets Talking Therapies with the first link that comes up, if you just click onto our website and there's a tab that says Get Started. Once you click on that tab, there'll be another option to refer now. And you just need to fill in that short form, submit that, and then, as I say, we'll be in touch within that 2 weeks to book the person in for an assessment.
Wonderful. Thanks, Khadija, and thanks very much for explaining the process and what you offer.
No problem.